The 2000 conference was pivotal in focusing the world's attention on the impact of HIV, particularly in sub-Saharan Africa, and fundamentally changing the course of the epidemic on the continent. It is worth recalling what former President Nelson Mandela said at that conference. When he closed the conference, he said, "Let us not equivocate. A tragedy of unprecedented proportions is unfolding in Africa. AIDS today in Africa is claiming more lives than the sum total of all wars, families and famines and floods, and the ravages of such deadly diseases as malaria. It is devastating families and communities, overwhelming and depleting healthcare services, and robbing schools of both learners and teachers." A decade and a half later, thanks in large measure to the deliberations at that conference and the unparalleled response of the global health community, we have made much progress in tackling the epidemic in Africa, as well as across the world. But although we can claim many achievements, we cannot yet claim success. Several countries on the continent have implemented massive treatment and prevention programs that have had a marked impact on HIV incidence, life expectancy, and maternal and infant mortality. South Africa, with the highest number of people living with HIV in the world, has rolled out the world's largest treatment program with well over 2 million people initiated on antiretrovirals. Though we have made progress in many areas, we are still concerned about the stubbornly high numbers of new infections, the challenges we face in ensuring that those who are on treatment are supported to continue taking their medication, and that stigma continues to undermine the impact of our programs. As we prepare for AIDS 2016, we will intensify our efforts to address all these challenges. In this context, I wish to commend the South African private sector for the initiative they have taken to combat the epidemic. I also wish to commend all our partners in SANEC for the contribution they continue to make, both individually and collectively, through collaboration and coordination, through learning from each other, through engaging with each other. We will enhance our ability to bring the epidemic to an end.